What is the difference between essential and Parkinson's tremor in early stages? When it comes to understanding tremors, many people wonder about the differences between essential tremor and Parkinson's tremor, especially in the early stages. These two conditions can appear similar but have distinct characteristics that set them apart. First, let's talk about the type of tremor and when it occurs. Essential tremor is primarily an action tremor. This means it happens during voluntary movements, like when you are reaching for something, writing, or even drinking from a cup. You might notice the tremor getting worse when you are trying to hold a position. On the other hand, Parkinson's tremor is mainly a resting tremor. This means it appears when the affected limb is at rest, like when your hands are resting on your lap. Interestingly, this tremor often decreases or disappears when you start moving. Next, we can look at the frequency and intensity of these tremors. Essential tremor usually has a higher frequency, around 8 to 12 Hz, and tends to be rhythmic during action. In contrast, Parkinson's tremor has a lower frequency and is less variable in intensity when the limb is at rest. Now, let's consider how these tremors affect the body. Essential tremor often affects both sides of the body symmetrically, especially the hands, but it can also involve the head and voice. In fact, head tremor is quite common in essential tremor. However, Parkinson's tremor typically starts asymmetrically, often beginning in one hand or limb before potentially spreading to other areas like the legs or chin. Head or voice tremors are not typical in Parkinson's. Associated symptoms also play a role in distinguishing these conditions. Essential tremor usually occurs without other neurological symptoms. It does not come with stiffness, slowed movements, or coordination issues. Conversely, Parkinson's disease includes additional motor symptoms such as bradykinesia, which is slowness of movement, rigidity, and impaired balance. These symptoms help differentiate Parkinson's from essential tremor. Lastly, let's discuss progression and impact. Essential tremor tends to worsen gradually over time but is not considered life-threatening. While it can become disabling in severe cases, it does not typically lead to other neurological deficits. In contrast, Parkinson's disease is a progressive neurodegenerative disorder, meaning it gets worse over time and affects both motor and non-motor functions, requiring comprehensive management. In summary, essential tremor is characterized by action-induced shaking and symmetrical involvement without other neurological signs. Parkinson's tremor, however, is a resting tremor that usually starts on one side of the body and comes with additional motor symptoms like stiffness and slow movement. Understanding these differences is crucial for accurate diagnosis and management. If you or someone you know is experiencing tremors, consulting a healthcare professional is essential for proper evaluation and care.